ethics. We are going for ethics now. Okay, greetings to all the students. Greetings to all the auxiliary nursing students. Okay, we are sincerely sorry for the delay in our broadcast today. So basically, we are a little bit delayed because of the late anatomy class that we need to have so urgently. So now we are back online right now to take you through ethics of nursing. So basically invite all other students so that we can also be able to take part in this lecture process. So due to the COVID-19 outbreak, we will be coming live to your home with some studies online to the very same students who are not be able to make it for our one-on-one or classroom lectures. So just share this video now to students, only to students. Just share the link to only students who are part of the already existing auxiliary nursing program. So in the next few minutes, we are going to start with what? Our ethics of nursing. In the next few moments, we are going to start with our ethics of nursing. And after these tutorials, the video will only remain on the page for only 3 hours. And after 3 hours, we delete the video on the page. It is an institutional measures to get or to reach hand to those of you who are far away and locked down due to the COVID-19. So please, it's just only meant for the Expert Healthcare Training Institute student. Thank you so much. So basically today we are going to start with what we call ethics of nursing. Ethics of nursing. So basically we are taking our studies today from the recommendation of the Health Council and the recommendation of Ministry of Health. So ethics simply just means the things that we are supposed to do as health professionals to make sure we give the best to our patients, the rules and the regulations that we need to follow as health professionals so that we can be able to give the best to our students, and then also the code or the ethical code that governs the nursing profession. So if you want to be a nurse, if you are a nurse and you are aspiring to be a nurse, then you should be able to be mindful of these ethics, because these ethical codes are principles that governs the nursing professions. And in case of any misconduct as a nurse, in case of any misconduct as a student nurse, these ethical codes are going to bind you, and the nursing council will hold you accountable, the society will hold you accountable, and the whole world will hold you accountable based on these ethics. So today, I want to give you a general review, a general preview about what ethics is all about what ethics is all about. So in our daily works, ethical code of conduct need to come with our professions. I repeat again, in our daily works as nurses and health professionals, ethical code of conduct need to govern our work and our professions. So in everything that we do, ethical principles are required from we the health professionals to maintain a good professional standard in our hospitals, in our once you carry the image of the nursing profession, even in the house, you need to possess or you need to walk in that professionalism. A lot of people say that, no, I'm out of the hospital so I can live my life anyhow I like. No. The ethical code of conduct binds you both professionally at the workplace, and once you leave the workplace and you find yourself in the community, people still know that you are a nurse. So your conduct in the community also will reflect back to the nursing profession. So all this code of conduct is to guide us and protect us whilst we work as health professionals, and also to make us to live reasonably in the society. So today I'll start with something that it is very, very vital to the heart of the Nursing Council and the health ministry as well, is how we will be able to put this professional ethics into practice so that we can be able to give the best to our patient or our client. The first one that I will talk about is respect for response. Respect for response as our first ethical principle or core ethical value. Respect for response. Respect for response. For example, if a patient insulted you, the health professional, or a patient say anything bad to you, the health professionals, how will you react to that? How will you adjust to that situation? So our ethical code of conduct or our ethical value, our ethical principle will teach you how to respond to such criticism, to such misbehavior in the hospital setting or in any part of our healthcare facility. A typical example, if a patient tells you that you, this nurse, you don't know your work, how will you respond? Obviously, such a statement comes to hit you. Such a statement comes to boil down to your integrity. Such a statement will hit you hard. You will not be able to, if you don't take time, you react and say something funny to your patient. But as a health professional, how will you go about this? This is simple. So the answers to such a situation is what we call respect for a response. So how does the respect for the response work? It works in such a way that you will give a positive answer in place of the insult that has been given to you. You will give a positive answer in place of the ridicule that has been given to you. For example, if the patient said, you, this nurse, you don't know anything, you don't know your work, you don't know how to do your work, a typical answer would be, oh, I'm so sorry. I'm still learning and I'm still in the process of learning so that I can be able to give you the best. So this typical answer will not raise an insult on the patient, but rather it will give room for the patient to understand that learning is a process. And every health worker, whether you being a registered nurse, an enrolled nurse, whether you are a care worker or a caregiver, whichever category that you serve in, each and every day is a learning process for you. And then also the nursing profession, as we know, you may not be able to be good in every aspect. You may be good in an aspect, you may find it difficult and challenging in certain aspects. That is why each and every single day you need to be able to what? To learn. The profession itself is a learning ground that each and every case that happens during the hospital give you a moment or a room to learn. So the answer of respect to a response or respect for a response is the best way to answer bad situations at the hospital or to answer bad things that people say to you. Even you as a health professional, this is not only limited, or these ethical values and principles is not only limited to the world. Even in your own home, people will say bad things to you, but how do you answer? Instead of answering them back with bad things, instead of saying bad words to them, you rather use respect for response as an ethical principle to reply them back. A typical example: if the patient insulted you, you will smile and appreciate the patient and let the patient know that you are in the process of learning. So you will continue to learn to become more perfect so that you can be able to what? To care for the patient. So that is one of the ethical principles that is recorded by the Health Professional Council that we need to adopt as health professionals so that we can be able to what? To go about our daily activities. In the process of our studies, if you are not clear with something, please put the comment on the comment section for me to have a look at, and I will be able to answer you. Okay, so once I see the comment at the comment section, I will be able to answer every questions that you have. If you are not clear about something, please put the comment at the comment section and I will be able to access it and answer you. The next ethical code or ethical value or principle I would like to talk about is what? Respect for a person. We talk about respect for response. Now I'm going to talk about respect for a person. So in a respect for a person, you need to respect every patient that comes to your health facility. Whatever health facility you find yourself, either being in the hospital, either being in the health center, either being in the clinic, whatever health setting that you find yourself, you need to accord a higher level of maximum respect to each and every patient, regardless their religion, regardless their belief, regardless of their tribe, regardless of the kind of language they speak, regardless of their creed, color, or whoever they are. You need, as a health professional, to accord respect to every single person that come to your health facility. You don't prove to them that you are a nurse, you are a caregiver, you are in charge, you are a matron, you are a principal, you are the head of department. You don't prove to your patient that you are in authority, but rather you respect them from their perspective. Rather, you respect them from their belief, their cultural background, their perspective of understanding pertaining to the things of what? Health. So that is one of the ethical principles that we need to adopt as health professionals so that we can be able to give the best to our patient. And that is one quality of you, a nurse, to respect your patient. It doesn't matter who they are, it doesn't matter their dress code, it doesn't matter how they look, it doesn't matter how funny they look, it doesn't matter how beautiful they look, how handsome they look, it doesn't matter what kind of creed they have, but you as a health professional, you need to respect every single patient, respect every detail of the patient that comes to you. What are we seeing in our hospitals these days, in our society? I am a Caprivian, so I will only respect a Caprivian. I am an Ovambo, so I will only respect people who are Ovambo. I'm from the colored origin. I'm from this tribe, I'm from this tribe, I'm from that tribe, I am from this tribe. I am a colored, I am a white, so I will only respect white people. Then we begin to undermine when the other races come to the hospital, other creed come to the hospital, other cultural background come to the hospital, then we begin to discriminate against them. That is not professional. Our level or our high level of professionalism comes when we begin to see every human being as equal, every human being as a valued person, and begin to respect every aspect of their life, respect every details of their life. So that is one of the ethical principles of we the health professionals. Whether you are a registered nurse, you are an enrolled nurse, you are a caregiver, you are an auxiliary nurse, or whichever profession you find yourself pertaining to have, these ethical principles bind you. So you need to understand clearly that when you go against these ethical principles and you disrespect any patient, disciplinary actions will be taken against you, the health professional, and it becomes a medico-legal issue whereby they will take legal issues against you. If you disrespect the patient pertaining to their medication, pertaining to the services that they need to provide for them, at the end of the day, it is suable. They can sue you, and at the end of the day, the hospital facility will not defend you. At the end of the day, the nursing council will not defend you. The nursing council will take it up, and you may end up losing your license to practice. And once you lose your license to practice, there is no other way that you will practice your nursing profession. Because once you get a nursing job opportunity, even outside the country, Namibia, the nursing council have to what? Recommend you. The nursing council have to what? Recommend you. So based on their recommendation, will depends how they will register you elsewhere. So let us all cue into these ethical principles as we take care of our patients in the world, having in mind that we need to become so principled in carrying out our duty. The next one that I will talk about is taking the best interest and the well-being of our patients is also an ethical principle which is known as non-malfeasance. Non-malfeasance. Non-malfeasance is one of the ethical principles that make healthcare professionals, either being a nurse or whichever grade you are, to take the best interest and the well-being of your patients. So, ethical principle non-malfeasance says that you should not by any reason, you should not by any means cause harm to your patient, either directly or indirectly. That is the principle of non-malfeasance. So you should not maltreat your patient. You should not directly cause any harm to your patient. You should not in any way indirectly cause harm to your patient. And once you do that, you violate the ethical principle, which it will be used against you, the health professional. So those of you who are nurses, those of you who are caregivers, those of you who are auxiliary nurses, you need to understand these ethical principles whilst you work in the world. I repeat this. The ethical principle non-malfeasance is an ethical principle that encourages health professionals not for any reasons cause any harm, either directly or indirectly, to their patients. Instead, you should take in the best interest and be more mindful of the well-being of your patients. Most of the times, how do we cause indirectly harm to our patients? Delay in providing services to our patient automatically cause indirect harm to our patient. For example, if you are supposed to give medication to the patient on time, the patient is supposed to take their medication in the morning by 6 o'clock, and you, the nurse, you decided by giving the medication by 6:30 or 7 o'clock, due to the reason best known to you, you automatically cause indirect harm to your patient. Do you know how it happened? It simply means that every medication has a specific duration to work. So if the patient is supposed to take the medication by 6 o'clock, it means the previous medication would have finished working before exactly 6 o'clock or some few minutes before 6 o'clock. So you need to introduce another medication which will continue working from that time. So if you delay timing in giving medication to yourself and give the medication according to your own time, scientifically, the medication doesn't still work as expected. So instead of the medication working as expected, the medication will not work. Automatically, you are giving self-harm to the patient indirectly. Delay is one of the way we harm our patients indirectly. So if you are a health professional, you should by no means delay your patient in taking their vitals, delay your patients by giving them medication, delay your patient by feeding them, or delay your patient by assisting them to bath, or delay your patient by assisting them to eat. Because most medication also have to work with the nutrient. Most medication needs to bind with the vitamins. Special vitamins will be like water-soluble vitamins and fat-soluble vitamins. Medications needs to work with them. That is why some medications strictly required a patient to eat before taking the medication. But if you as a healthcare professional and you don't allow your patient to eat before you give the medication, at the end of the day, the medication also required energy to work, but the patient will not be able to get the required energy to work. Indirectly, you are causing harm to your patient. So these are few examples on how we can harm our patient indirectly. Another typical example of direct harm that we cause our patient is by reacting to every single thing the patient does. If the patient insults us, we react to it. If the patient insults us, because of that, we will stay far away from the patient. We don't want to have anything to do with the patient. Sometimes some health professionals react by either slapping the patient, by either causing any injury to the patient because of their level of temperament. So all these things will cause a direct harm to the patient. And it is legally bound. You can be sued for this, and you can actually lose your license to practice. That is why in the classroom we teach you all these things, so that once you go out there, you can be able to put it into practice so that you can give the best to your patient. One other way that we cause harm to our patient is not strictly following instruction. Every health procedure or nursing procedure comes with a specific instructions. So if we don't follow the instruction given by the medical doctor, the instruction follows or given by the registered nurse or the matron or whoever that is in the position to give the instructions, so that others who are supposed to be able to what? To execute the instruction needs to follow the instruction. We need to understand this. If they said check the patient vital signs every 1 hourly due to the high level of blood pressure of the patient, you are supposed to check every 1 hourly. Because every little delay, let's for instance, you previously checked the vital signs of the patient and is recorded 160 with the systolic pressure and then 110 with the diastolic pressure. At the end of the day, you will be able to be monitoring these vital signs until it reduces. But if the blood pressure still continues to rise, then it is your responsibility as what? The nurse, to know the next measure to take. To know the next measure, which of the IV line or the IV infusion to be put on the patient, so that the patient may not develop stroke at the end of the day. If your patient's blood glucose level is very high and you're in charge or the doctor instructed you to be checking it every 30 minutes or every 1 hourly until it has reduced to the level of either from 4.0 to 6.0, and then you find it on a higher level like 19.0 or 18.0, 16.0, at the end of the day, what will you do immediately? Which of the IV line will you put on the patient? Doctor will give you all these instructions, but your ability as a health professional to follow all these instructions to make sure you reduce the blood glucose level to a duration of 4.0 to 6.0 millimole per deciliter matters. So one thing you need to understand as a health professional is when you don't follow instructions, you kill your patients. You indirectly or directly cause harm to your patient, and at the end of the day, you will kill the patient gradually. The patient may not die immediately, but that delay can cause subsequent effects, cause subsequent deterioration of the body system or organs in the body, and at the end of the day, that alone can kill the patient. That is the reason why we need to be more mindful as healthcare professionals, so that we follow principles, we follow instructions whilst we are carrying out our duties in the hospital setting. The next one that I will talk about as an ethical principles or value is beneficence. The first one that we talk about is non-malfeasance. Then the one that I will talk about now is what we call beneficence. Beneficence is also an ethical principle that governs we the health professionals, whether you are a nurse or whoever you are, to do everything humanly possible to make sure you give the best to your patient. Beneficence is an ethical principle that governs we the healthcare professionals to make sure we go extra mile, we go to the extent that we can be able to give the best to our patients. So a typical example of beneficence is you going extra mile to make sure your patient eats on time, your patient take their medications on time, you check vital signs on time, and if there is any deviation from normal, if there is any abnormality, you promptly report to your in charge or the medical doctor in charge and take an instruction for prompt actions. So doing all these things, you are giving the best to your patient. And sometimes your patient will become so frustrated, your patient will become so worried. What do you need to do as a healthcare professional? You need to create more rapport and begin to win the trust of your patient. You need to begin to talk in a very lovely way, create an atmospheric environment for the patient to be able to express himself or herself. So through this, you will be able to give the best to your patient. Sometimes also, the patient may be able to lose hope in life due to the severity of the condition, but it is our responsibility as health professionals to be able to motivate the patient, either intrinsic motivation or extrinsic motivation. Intrinsic motivation, what I mean is for you to give internal motivation, to initiate the internal motivation from the patient. So every single morning when you come, you look at the patient, oh, you look wonderful. You say positive affirmative words to your patient all the time. You say nice words to your patient, motivative words to your patient, and always let your patient seem reason that there's always hope at the end of the tunnel. With that, it will motivate the patient. Secondly, also, when you have little time, you need to get to the patient room, sit with the patient, have chat with the patient, create more room for the patient to talk about her worries, to talk about the things that are bothering her or him, to talk about the grieving issues that the patient is currently going through. Then with that, you will be able to address the areas that you need to address, either through counseling or either to heart talk, or either using one or two examples to be able to address the issue. And at the end of the day, by so doing, you will be able to motivate the patient internally, and the patient will be able to see reasons why they need to leave. External motivation will be extra activities that we will do just to please our patients, just to encourage them. For instance, the patient cannot be able to walk. By the time you see the patient walking with the walking stick, you quickly rush and assist the patient to walk. The patient is coming from the bathhouse, holding the towel, holding the sponge, holding everything. You quickly rush to take everything from the patient, and you quickly assist the patient to bed. A typical example: you walk into the ward and you realize that the patient's bedding is crisscross or dirty. What do you do immediately? Oh, Madam so and so, patient so and so, I realize that your beddings are dirty and I just need to change it for you immediately. That atmosphere of caring encourages the patient that somebody also cares about them. The other way around that we can give the best to our patient is by giving them the listening ears. Is by always listening, always to listen to them, to talk. Not us talking all the time. Some health professionals, by the time the patient wanted to talk, you already know already, you have already concluded the situation already. No. You need to give the patient room to talk about the things that are bothering her or him. You need to let the patient come out with his or her own view so that you can be able to use reflective sentence like, okay, Okay, is that so? Okay, and that is one of the good listening skills. Then the ones that you need to reflect on, you will be able to say, okay, if I may hear you well, did you say this? Did you say that? Did you actually say this? Okay, this is how it's supposed to go. Sometimes patients get upset because they do not understand the procedures. Sometimes patients get worried if none of the nursing staff explain to them what is going on about them. You will see honorable nursing staff just walk to the patient, please, let me check your vital signs. Even after checking of the vital signs, they don't explain to the patient the outcome of the vital signs. Please, I want to take your blood sample. Why are you taking the blood sample? You need to first create a rapport with the patient. In the process of creating the rapport with the patient, just to win the patient's trust, and also ask for the consent of the patient before you carry out any activity. In the process of creating the rapport, you need to explain the reason why you are about to carry out that activities, so that the patient will become well informed and the patient will also be involved in the management process or in the treatment process. But most at times we find it difficult to understand that nursing staff treat patients without even explaining to the patient what they are treating, without even explaining to the patient what is wrong with them. So patient is obviously just lying on the bed. That is not a good practice, and that is not how we are trained as health professionals. So don't forget, this is not for the purpose of the word. This is for the purpose of your training, so that you will know the best thing to do when you go to the world. So this is how you will be able to what? Give the best to your patient, to the benefit of your patient. Like I said, if you have any questions, please put the questions in the text column or in the message column, so that I can be able to see them and I can be able to what? Answer all your questions. So I would like to see the questions flowing. I would like to see the question coming up, so that at the end of the day we can be able to what? Give you the best as our student, and we can be able to what? Initially address all ethical issues that we need to address to your level of understanding. And the next ethical value that I'll talk about is human right. Human right. The patient chapter, as time goes on, I will be explaining to you what the patient chapter is all about. It's just simply talking about the rights and the responsibility of each and everybody, the right of the patient, the rights, the responsibility of the patient, the right of we, the health staff, and the rights, our responsibilities and duties in caring for our patient. But the right for human, the rights for human or human right, it is important that we respect everybody's right as what? Human. When they come to the hospital, that is one of the ethical principles that govern we, the health professionals. It is an ethical principle governing we, the health professional, to respect every human's right. For instance, recognizing the same interests of individuals may be so much important in managing their health conditions. So in the hospital, you need to know the interests of the patient. What is the patient interested in? And what is the patient not interested in? The things that the patient is not interested in, probably the patient lack understanding in that aspect. So it is your responsibility as health professionals to be able to explain to the patient the areas that he or she is lacking an understanding. So with that, we can be able to bring the patient on the same page of management or treatment as we, the health professionals, are also going through the same stage. It is very clear that recognizing the interest of the patient is very, very vital to the management of every patient's condition. For instance, if you don't seek the interest of the patient and you just start, you want to treat patient will not cooperate with you. Patient will not be on the same page with you. It's just like the health professional, you will be at one side, and then the patient will also be at one side. And most of the time, this happens to the health professionals who are in the counseling department. If you don't seek the interest of the patient, and if you don't seek more explanation, or if you don't give more explanation to the patient will allow you to flow. But in a nutshell, the patient will not take part in the management process. Then at the end of the day, you will only waste your time with whatever thing you are doing with the patient, because the patient will not cooperate. So one, let us find the interest of the patient in order for us to respect their human right. Also, let us understand the requirement for human right. Let us also required or understand the requirement of human right in the form of what? The claims, the issues that arise from the patient. We need to understand. Not always the patient do need to understand we, the health professionals. No, we also need to understand our patient from their perspective. And if we realize their perspective is there as a result of lack of understanding, then we throw more light on areas that they need to understand. So at the end of the day, if we don't throw more light in those areas, the patient will lack information and they will not cooperate with us. That is the only way we can go about in respecting the rights or understanding the human right, so that we can be able to acknowledge them in taking care of our patients. All these things that I'm discussing is in the book of the Health Professional Council, the ethical guidelines governing we the health professionals. So it is very important that we take note of these ethical principles so that we can make the health profession a better place. We can make our hospitals a comfortable and a desirable place for our patient. The next ethical principle I'll talk about is autonomy. Autonomy. Autonomy is one of the ethical principles that govern we the health professionals to understand or honor the patient's right to self-determination. Autonomy is one of the ethical principles that governs we the health professionals and the patient to understand the patient's right to self-decision making and self-determination, or to make their own informed choices. Don't forget, it is not in our place as health professionals to make decisions for our patients. No. But it is in our interest to educate our patients, to throw more light and give more information to our patient regarding to their health situation, so that they can also make their own informed decision concerning their health. I repeat again, it is not in the interest of we health professionals to what? To take decisions on behalf of our patient or our client. But it is in our best interest to educate our patient on matters pertaining to their health, explaining aspects that we need to explain to give them more clarity of health issues concerning the patient, so that out of all this explanation, the patient themselves can be able to make an informed choices pertaining to their health. With that, it gives them their right to autonomy. It gives them their right to make their own informed decision. It means we, the health professionals, we respect the autonomy of our patient. We respect the right decision-making right, the decision-making right of our patient. So on this note, I'm encouraging all students to acknowledge this and know that this ethical principle binds us not to make decisions for our patient, but in our position, we can be able to educate our patient, throw more light on issues that they need to know, address their concern to their level of understanding, using the language that they will understand, so that they can be able to make their own informed choices. If something is not clear to any of the students or anybody, please do let me know so that I can be able to explain to you further. You can also engage the comment section and send me all the questions that you are not clear of, so that I can be able to explain to you. Good. The next thing that I will talk about is integrity. As human beings as we are, if any of us lose our integrity, our self-esteem is at stake. So, building a higher integrity for our patient, respecting the integrity of our patient, is one of our ethical principles, so that our patient will not look mean upon themselves, or will not undermine their own qualities, or we as health professionals, we will not undermine the capabilities and the abilities of our patients. So integrity is one of the ethical principles that talk about the patient good, moral, upright, the patient good, moral, upright, in terms of the decision that they make, in terms of the action that they took, based on their ethical values. Each and everybody make decisions based on their ethics, or cultural beliefs, or cultural backgrounds, or we make decisions based on the things that we believe in life. So at the end of the day, this belief put us in a position in terms of decision making. So when we find such patient in the hospital or any healthcare setting, we should be able to understand their belief from their perspective and respect their integrity. With that, we are honoring their decision-making abilities, and we are also respecting their high level of self-esteem. But anything contradicting to this, when we refuse their belief, when we reject their perspective, at the end of the day, it makes them look mean upon themselves. It makes them undermine themselves, and obviously it will affect their self-esteem. And this is how most patients develop low self-esteem. So everything you say to them, okay. Anything you say to them, okay. Anything you tell them, okay. They will never explain anything. They will never contribute. Their answer will just be okay, okay, okay. So they don't have that ability anymore to say no to anything, because they lose their level of higher esteem. So we as health professionals, we need to be very mindful of this. We as health professionals, we need to be very mindful of this. Then the next one that I will talk about is truthfulness. In a professional relationship with our patient, regard the truth and truthfulness as a basis of trust. We need to be truthful to our patient. We don't need to beat around the bush. We need to be truthful to our patient. If it is a headache that is the problem, let us not tell the patient it is their stomach. Let us not misinform their patient. Let us not misinform our patient. Because at the end of the day, misinformation to the patient will lead to decision making. Misinformation to our patient will lead to wrong decision making. So the patient have rights to their information. So be truthful to the patient. Sometimes we don't strictly go by telling the patient what they strictly need to know, but sometimes we use our counseling skills and we use the tools available for our counseling in exposing the patient to the truth, to the stage where they will be able to understand the truth without causing them any pain directly or indirectly. So let us learn to be truthful to our patient. Let us learn to build trust through truth telling with our patient. With that, the patient will be able to bond with us, health professionals. The patient will be able to have more trust for us so that we can be able to care for them. The next one that I'm going to talk about is what we call compassion. Compassion. Compassion is one of the ethical principles that we need to understand as health professionals. Compassion is one of the ethical principles that we need to become aware of. And we need to be able to use these skills in rendering an efficient services to our patient. How do we become compassionate to our patient? To become more sensitive to and emphasis or play emphasis with individual and the social need for the comfort and the support of our patient, and seek or create opportunities to translate emotions such as feelings through the use of sympathy and empathy. So for you to be compassionate, you need to be able to identify the problem of your patient. In identifying the problem of your patient, either through their emotions, either through the things that they are going through that they may not be able to express, either through seeking for attention, you need to use the skill of sympathy and empathy to be able to attend to your patient in a sufficient and effective way that they will be able to like it. Sympathy and empathy are not the same. They are two different words, but similar. When we talk about sympathy or to become sympathetic to our patient, we are actually saying that we should become so mindful, or we should become so sorry. We should feel for our patient. We should feel for the things our patients are going through. We should show to the patient that we feel for them, and we should prove to the patient that we are ready to be of help to them at any given point in time. That is all what sympathy is all about. So you show a concern to your patient. The process of you showing a concern to the patient and you letting the patient know that we are ready to care for you, we are ready to use our available resources or tools to help you to overcome this level of sickness, is what we call sympathy. Then empathy, you will now put yourself in the patient's shoe to assume if you are the one in that shoe. To assume you are the one in that shoe. So if you are the one in that shoe, then the golden rule will appear that you should do to others what you want others to do unto you. Then you will be able to care for your patient the same way if you were to be the one, you would like people to care for you. So over there, empathy or being empathetic will create a room for you to go extra mile in caring for your patient, in doing everything humanly possible to alleviate pain, to alleviate the pain of your patient, to reduce the pain, to make sure that you let them know you feel for them, you understand what they go through, and you are ready to go extra mile to take care of them. That is empathetic. So that is also an ethical principle that we need to adhere to. And basically, for you to win the patient trust or to win the patient over, you can use the skill of being sympathetic and being empathetic to win the patient over. Definitely, once you render this kind of skills and services to the patient, it will give room to the patient to feel that you actually care for them and you are actually there to assist, not to cause harm to them. The last one that I will talk about for today, is what we call confidentiality. Confidentiality is one of the ethical principles that governs with the health professionals. It's one of the ethical principles that governs with the health professionals. So confidentiality in our professional relationship with our patient, we should be able to treat personal or private information about the patient confidentially. In our personal relationship or professional relationship with our patient, we should be able to treat personal information or private information about our patient confidentially, without any second person knowing about it, without any third person coming into it or coming to know about all those information. So every presenting history that you gather from your patient, when I talk about presenting history, I'm talking about the first-hand information that you get from your patient whenever they come to the hospital. So immediately they come to the hospital and you are admitting them, you ask them few questions, the reason why they are in the hospital, what is the problem, when did the problem started, how did the problem started, so when, how, where, who, all those questioning skills will be ushered or will be put into action. Then at the end of the day, it will help you gather a lot of information from the patient. And all this information that you gather from the patient is strictly for management or therapeutic reasons, which need to be kept under lock without a third person getting to this information. without a second person also knowing this information. So that is what confidentiality is all about. There is a difference between you being confident in yourself to do something and then assuming the skills and then the ethical principle of being confidentiality. Confidentiality, you keep every detailed information of your patient sacrosanct or privately, or you keep the information of your patient confidentially so that no other person can have access to it. By so doing, you are protecting the integrity of your patient. You are protecting the rights of your patient. You are protecting the autonomy of your patient. You are rendering the ethical principles of what? Beneficence to your patient. And also, you are putting yourself in the shoe of non-malfeasance to your patient. So this is what we need to understand. A typical example: if you are a nurse and you take the patient through presenting history and the patient tell you, I'm frustrated because I realize I'm positive to HIV case, that is a valid information about the patient that you need to preserve, not allowing any third party to hear about it. But most at times, what do we see in the world? You will see some people sitting down, some in charges sitting down, some good professional nurses sitting down, and they are addressing patient or calling patient from afar. For instance, if you are calling two patients and this one said, is it me? Then they will say, no, I'm calling the patient with the HIV. Hello? It means you are not confidential. It means you lack the ethical principle of confidentiality. Sometimes they will address the patient. Can you call that patient with the amputated leg? Hello? That means you lack the ethical principle of confidentiality. Do not address patients by their health condition. The ethical principle of confidentiality binds with the health professionals not to address our patient with their health condition. They have names. They are Mr. So and so. They are Mr. Lipin or Mr. Lukunga or Madam Lukustu or whatever. Madam Lucy, Madam Joanna or whatever. Refer them with their name. Do not refer them with their health condition. If you do refer patient with their health condition, at the end of the day, what are you doing? You are basically exposing them to the world. You are actually exposing their secret. You are actually exposing their dirty linen to the public. At the end of the day, they will lose their self-esteem, they will lose their respect, they will lose their trust, they will lose their dignity, they will lose every aspect of them. That is why some patients go as far as what? Committing suicide once they leave the hospital, because they know the society is already aware that they are HIV positive. The society is already aware that they are having mental problem. The society is already aware of their dirty linen. Please, health workers, please, nursing students, please, health professionals, it is our topmost priority to become sacrosanct or to become more confidential in data or information that we gathered from our patient. So on this note, I bring the class to an end, and I thank you so much for taking part of today's lectures in the comfort of your home, by taking part of today's lessons in the comfort of your home. Remember, tomorrow, same time by this time, or the time we started today, we'll still be with you and take you through ethical code of conduct. It's one of your subjects that is mandatory to you to learn, which will help you to qualify you for the upcoming program that we are about to enroll, which is the Enroll Nursing Program. So I entreat all of you to be serious with this. All those who are taking part in this exam or in this education or in this lecture moment, Friday will be a moment for your what? Your quiz, which will be assessed over 25 marks, and it will take 25% of your total mark out of 100. So I entreat all of you, from now till Friday, I'll have much time to explain to you as much as you can explain. Those who are in the Valvis Bay, the exam will come to you and your lecturer will supervise the exam. Those who are in Rundu, the exam will come to you and your lecturers will supervise you. Those who are in other parts of the country, the exam will come to you. So from today, we'll be having most of our lecture moment on Facebook Live on our official page, so that you can be able to learn from distance. This is one of the initiatives of your noble institution. God bless you all. Remember, one of the things I used to teach my students, that when it is time for you to learn as if there is no other things to do. And when there is time for you to be at home and be happy as if there is no book. But in a nutshell, put much effort into your learning, push much effort into your studies, so that you can be able to what? Learn really very hard. Don't forget, this subject is only ending next week Friday, where the final exam will occur next week Friday. So take your lesson seriously. If you have any question, engage the comment box. Then I will be able to take all the questions, and I will be able to address all of them. If you have any concern, contact the school so that we can be able to give you the best. Somebody asked, tomorrow will be on time. Anyway, thank you so much, sir. Thank you also so much for taking part in today's lesson. On this note, I say take care of yourself. Those of you who are in Valvis Bay, the virus is still flying. Take the precautionary measures and be safe for us. God bless you all. My name remains Prince Selassie Gamor. God bless you, and I will see you tomorrow. Bye-bye.